As you can see, this eye is not blinking. I can't smile on this side of my face.
Referring to that video, Justin Bieber was talking about a new diagnosis of Ramsay Hunt Syndrome, which has made him unable to perform his concerts, so has to cancel or reschedule. This is the condition that has affected his face, as you can tell from the video, affecting one side of his face, and he will need a prolonged period of time to recover. In this video, we will be talking about this condition called Ramsay Hunt Syndrome. We'll talk about what it is, what causes it, the symptoms, treatment options, as well as the long-term prognosis. Before talking about Ramsay Hunt Syndrome, you have to talk about chickenpox or varicella zoster virus. VZV causes the primary infection called chickenpox. So if you get infected with this virus, you develop chickenpox. Most adults do not experience this, one, because they've either been vaccinated in the past or they probably had this infection as kids. So with chickenpox, the rash is usually localized to the face and the trunks. Not saying you cannot have it everywhere, you can have it everywhere, but most of the rashes will be found on the trunk and on the face. So herpes zoster, also known as shingles, is a reactivation of the varicella zoster virus, which lodged itself and has been docile and latent in one of your nerves following a primary varicella zoster virus infection or chickenpox infection. The rash associated with this condition is very characteristic. It is usually unilateral, note to be on one side of the body, painful, blister-like rash. It's kind of like a band that goes across your body but tends to stop in the midline, so it does not cross the midline. Although this condition is more common in those older than the age of 50, it can affect people of all ages. It is also more common in those that have a weaker immune system than normal. With Ramsay Hunt Syndrome, this is known as the major otologic complication of herpes zoster. In other words, it's a major complication of herpes zoster that involves the ear. Typically, we have a triad of symptoms, so 3 symptoms. The first one is very obvious, as you can see in the video with Justin Bieber, where you have ipsilateral facial paralysis, which means weakness of the side of the face that is affected. You could have difficulty blinking and also an inability to maintain a facial expression on the affected side. The other 2 are ear pain and also a rash that can be found within the ear canal, the auditory canal, and also on the auricle outside of the ear. So the most common symptoms are those 3, but some people also have other symptoms that could involve the tongue. You could have decreased sensation or taste sensation, could also have lesions on the tongue. Some might have what we call vertigo or issues with their balance. You could have hearing issues like decreased hearing, hyperacusis. You could have tinnitus. And why do you have these specific symptoms? It is believed that you have these symptoms because it affects, or the reactivation of the virus affects the facial nerve around the inner ear, hence leading to symptoms that are in the distribution of the facial nerve. So once the virus gets reactivated and it infects the facial nerve, it can lead to irritation, inflammation, and swelling of the facial nerve, leading to these symptoms. In some individuals, it can actually affect multiple cranial nerves and not just the facial nerve. And you have symptoms that fall in line with the distribution of those nerves. So how do we treat this condition? The first thing to note is that treatment needs to start within 72 hours or 3 days of the onset of symptoms to give the best chances at a complete recovery. Usually we treat this condition with antivirals or a short course of high-dose steroids. Sometimes we give anti-anxiety and pain medication depending on other symptoms that the patient may have. But the main course of therapy is the antivirals and the steroids for a couple of days. Now, regarding prognosis or the long-term outlook for those that have been infected by this virus, if the damage to the affected nerve is minimal or mild, there is a high chance of a complete recovery over a couple of weeks. But if in this situation, the damage to the nerve is severe, it is possible that the patient might not fully recover even over a couple of months. The most important thing, like I said earlier, is ensuring that treatment or therapy starts within 72 hours of the onset of symptoms, as this will give you a better chance of having a full and complete recovery. And how do we diagnose this condition? Usually from a history, or a physical exam, your doctor could have a high index of suspicion for this condition. They might want to run some more tests, blood work, get a sample from the rash, some imaging studies, depending on the symptoms you present with. So if for some reason you have complaints that are similar to these, do not delay before you present to your doctor for help or for treatment. And while you're on these medications, the antivirals, the steroid therapy, and you're at home, it is important that you keep the rash as clean as possible, because if you don't maintain adequate hygiene, it is possible that you could have a bacterial super infection. Also, you can use cool, wet compresses over the rash to help with the pain. And if that's not enough, you can take over-the-counter pain medications, anti-inflammatory medications like ibuprofen, as it might help with the symptoms. So if the facial paralysis or weakness is severe enough that it prevents your eyes from closing or shutting, or you have difficulty blinking, it is important that you have moisturizing eye drops, which your doctor will likely provide for you, that you will use daily, as this is to prevent you from developing dry eyes. And also at night, you might need to have like moisturizing ointments that you apply to your eyes, and you might need to tape that eye shut or use like a patch at night to help protect that eye. And finally, we've come to the end of this video. We spoke about what Ramsay Hunt Syndrome is. We talked about chicken pox, talked about what the symptoms are, how to treat it, how it's diagnosed, and the long-term prognosis. I would like to thank Justin Bieber for being very open with this condition and letting the world know about this, as this has created more awareness about this condition. And I wish him all the best, hoping that he has a full and complete recovery, and can't wait to see him back on the road performing again. I am the WizDoc. Thank you for watching this video. If you haven't yet, please hit the like button, subscribe to this channel, and hit the notification bell for future videos. I will see you later. Have a great day. Bye.